Postoperative nausea and vomiting, also referred to as PONV, is a common clinical side effect to anaesthesia after surgery. PONV poses a detrimental impact on the patient's recovery, increased admission time, and general well-being. Astoundingly, postoperative nausea and vomiting is the most feared side effect of anaesthesia, even above pain. A journal by Smith et al. Estimates that over 100 million people around the world undergo surgery every day. 30% of those encounter vomiting and nausea in recovery. PONV can be self-limiting to the patient's recovery, can potentially delay discharge, it can increase the risk of unplanned admissions, and in severe cases could cause impairment to the body. If we're looking at the issue from a pathophysiological point of view, the exact reason for emesis occurring is not yet understood. However, vomiting or getting rid of intake that is potentially dangerous to the body is a natural defense mechanism of the gastrointestinal system. The primary control of vomiting is found in the vomiting center located in the medulla of the brain, of which breaks off into 5 different pathways. If by chance one of these pathways is triggered, vomiting will occur. When discussing the management of PONV and avoidance in its occurrence, McCracken et al. Describes that there are basic practice gaps in the prevention of PONV in preparation of the patient for surgery and postoperatively. Establishing risk factors of each individual surrounding any risks they are predisposed to, for example a history of motion sickness, has been recognised to be commonly left out of the preoperative handover. Furthermore, the patient should always be made fully aware that the option of regional anaesthesia, where advised by the surgeon and possible, lowers the risk of PONV in contrast to general anaesthesia. Systematically, by ensuring all aspects are recommended and understood by the medical professional and the patient, the overall occurrence of PONV could potentially be lowered, making the surgical experience much more comfortable and enjoyable for the patients and hospital staff. Blackburn and Spencer discuss the Apfel score, which determines at what risk an individual may rank due to the associated risk factors. These risk factors include being a female, non-smoker, use of violent anaesthetics, the duration of the surgery, previous history of motion sickness, and administration of post-operative opioids. As stated in Nausea and Vomiting After Surgery by Pierre and Whelan, 2013, the use of volatile anaesthetics can suppress receptors of the body to which prevent PONV. However, the article emphasises that by using alternative anaesthesia, including propofol, does decrease the risk of potential PONV. However, the drug itself has not yet been proven to have antiemetic properties. The Apfel score depicts that each factor begins at 20% risk of PONV, and depending on how many other factors the individual may obtain, increases to an overall 80%. When establishing the patient's risk score when going into theatre, it is important to gather as much personal and family history as possible to understand if PONV has happened before and how to start planning prevention. This evidence therefore poses significance on the importance of rapport building and full disclosure surrounding the type of surgery and one's risk of developing PONV. It is further crucial to educate the patient with the current situation and allow for therapeutic touch and reassurance if the patient seems stressed or unsettled prior to surgery. The answer regarding what exactly the nurse can do in preventing their patients of having to endure PONV is uneasily found. However, a number of pharmacological and non-pharmacological interventions are available. Blackburn and Spencer 2015 discussed the use of antiemetics, including ondansetron, and mentioned that it is best administered at the end of surgery instead of induction of anaesthesia. The use of steroids, including dexamethasone, and antihistamines, including xyclazine, have been highly indicated to be used in high-risk patients as they've been found to have further antiemetic qualities. As mentioned previously, postoperative nausea and vomiting can delay transfer from the post-anaesthesia care unit, or PACU, by up to 20 minutes. In severe cases, PONV can cause complications with wound dressings and sutures, disrupt absorption of medications, and form imbalances in the fluids and electrolytes of the body. This is evidently an unpleasant experience for the patient, Furthermore, it is the job as the nurse to implement some therapeutic or non-pharmacological interventions in ensuring that the patient is made to feel comfortable and therefore eager to begin their recovery. Cook et al. 2015 discusses the positive outcome that wrist acupressure has on PONV patients. World Health Organization first recognised acupressure in the early 2000s and is still recognised today as a helpful therapeutic tool. Stimulation of acupressure is a prophylactic technique and should be done prior to surgery. Stosia et al. 2015 further explains that the use of hypnosis, musical therapy and peppermint oil aromatherapy, although not 100% proven to alleviate all PONV, does have positive effects on the patient's comfort and likelihood of avoiding it. Ensuring that the nurse is properly trained regarding the therapeutic technique and the patient has consented to the alternative therapies. To conclude, it is crucial for all nurses and medical staff to implement risk assessment scores in hospital policy or theatre procedures. The use of monitoring high-risk patients thoroughly and ensuring that all prophylactic measures are undertaken before surgery is crucial. Patients should be given all of the information surrounding the procedure, anaesthesia options, and should speak with the anaesthetist if they have any questions. The rapport of the nurse and the patient is important in helping to alleviate anxiety, which could potentially decrease the chance of PONV. Ensuring that all interventions are taken into account and the patient is comfortable will make for a smooth and pleasant surgical experience and involve their patient in their own speedy recovery.